about, so we will certainly try our best. So, quickly giving context and moving to the question. So, in recent years, there's been an increasing prevalence of wheat related disorders such as celiac disease, non celiac gluten sensitivity, which are characterized by an abnormal immune response to gluten, a protein that is found in various grains like wheat, leading to inflammation and damage to the entire GI tract. Now, recent research has suggested a possible link between these wheat related disorders and liver conditions. While the exact mechanism and underlying this association are not fully understood, it is believed that chronic inflammation caused by wheat related disorders may play a role in this. However, emerging evidence suggests that wheat related disorders, especially celiac disease, may also contribute to liver damage and increase this risk of liver disease. In this panel discussion, we will explore the latest research on wheat related disorders and liver diseases, their underlying pathogenesis, mechanisms, and the implications that are there for clinical practice. We have with us stalwarts, luminaries, celebrities, whatever you want to call it, but in the field of liver diseases, gut health, and nutrition, from whom we would like to have an in-depth discussion on wheat-related disorders and liver diseases. So quickly jumping to my first question. Hi, good evening, sir. Sir, researchers have found and are of the view that patients with celiac disease should have their liver enzymes routinely checked, and they should be treated with a strict gluten-free diet. So, do you believe that patients with liver disease should also have their food sensitivity and celiac disease testing done? And also, we would like to know your view on the connection between liver diseases and wheat-related disorders. Thank you.
There are three parts. First, you asked whether celiac affects liver or a patient with liver should have a test for celiac and the approaches for management related to it. So the patients who have got celiac certainly can have liver involvement. Celiac makes the breach in the intestinal wall or permeability. It permits the toxins and the bacteria to sieve through. It can actually facilitate in a way because of the poor intercellular junctions. So once these toxins or cytokines reach there, it can be damaging the liver. I must tell you, many of you may not know that the TTG test was a serendipitous discovery. It was not meant for celiac. The guy, Detlef Schuppen, a very dear friend, he was working on, is a German working on liver disease. So he was working and he was doing proteomic studies for liver to find out what are the possibilities, which proteins can give the liver disease in a non-viral. So in the non-viral scenario, he came across TTG. And then this TTG became, that was a science paper, became that yes, you can diagnose this and it can affect. So there is a basis of relation of TTG and patients who have got celiac disease patients or TTG positive to have liver disease. The second part, do patients with liver disease should get their tests for celiac or wheat allergies and others? Certainly there is a good rationale, but I'll put 3 or 4 conditions. First, TTG alone is not so specific for this. So we must, anybody who has, you have a suspicion like unexplained rise in enzymes, or the patient has fatty liver disease and you have no fat in the liver. So you've done ultrasound or elastography, but there is no fat, but the enzymes are high. He's a lean thin. You would like to do this. And in such patients, first do TTG if it is positive, and especially more than 5 times. Then I would like to do an endomysial antibody EMA test. If the EMA is also positive, then you go for a biopsy. It is very important for those who take biopsies that their biopsies are from D1 as well as D2. So minimum of 6 biopsies, D2 4, D1 2 must be taken. And then classically, you must have more lymphocytes. So 3 level of testing. Why is it necessary? Because many patients with liver disease themselves can have scalloping and can have changes which look like celiac disease. So I think it is important that we have an index of suspicion, but a very high index for specificity. At least 2 antibodies should be used other than TTG. And the enzyme rise should not be more than 5 times. If it is more than 5 times rise, then I would say that this is not celiac. And more importantly, as I'm sure you will come to it, when you stop wheat, the enzymes must come down.